Recently, there has been a global upsurge in patients with what used to be a relatively rare condition, that is an allergy to red meat. It's called an AlphaGal. Today, we will talk about this condition, its symptoms, how it gets diagnosed, and what to do about it. Welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. Please like, subscribe, and share to help this channel grow. So, AlphaGal syndrome, or AGS, is a unique and relatively newly recognized form of a red meat allergy, which is different from traditional food allergies. This condition is triggered by a sugar or rather carbohydrate molecule that is called galactose alpha-1,3 galactose, or AlphaGal. AlphaGal is actually a molecule found in the tissues of most non-primate mammals. Or to say it simply, it is found in the red meat that we eat. This means that eating beef, lamb, pork, venison, and other mammalian meat, all of which contain AlphaGal, causes an allergic reaction that could be severe and actually life-threatening in some cases. So how do you get this condition? AlphaGal has been increasingly reported in the United States, Australia, and Europe. I can say that here in Cape Cod, we already have seen several patients with this recently. And the development of this allergy is often associated with tick bites, particularly from the species called the Lone Star tick, or the Latin name is Amblyomma americanum, which sensitize individuals to AlphaGal. So this tick doesn't cause bacterial or viral infection. Lone Star ticks can have AlphaGal in their guts and in their saliva. So when a Lone Star tick bites someone, it can pass AlphaGal to the person in its saliva. Due to this transmission via tick, AGS is more common in adults, and that is different from many common food allergies, such as allergy to milk, for example, that is more prevalent in childhood and then goes away in adulthood. Of note, some other foods contain AlphaGal. These foods include dairy products and even some medications. The ingredient in some medications and foods is gelatin. Gelatin is usually made from collagen that is derived from mammals. AlphaGal is also found in snake antivenoms and prosthetic heart valves, such as the ones derived from cow or pigs. So how does it happen on the immune level? This exposure to AlphaGal leads to the production of IgE antibodies specific to AlphaGal, which later cause allergic reactions when mammalian meat is consumed. Interestingly, the symptoms are delayed, manifesting 3 to 6 hours after ingestion. And that sets AlphaGal syndrome apart from the traditional protein-based food allergies. In traditional allergies, the symptoms come on earlier, often immediately. In fact, in my book, The Clear Skin Diet, I have the whole chapter discussing the onset and duration of food allergies and food sensitivities and its significance. So to stress it again, one of the most distinctive aspects of the AlphaGal is the delayed nature of the allergic response, often occurring hours after the consumption of red meat, rather than the immediate reaction typical of IgE-mediated allergies. However, the AlphaGal that is introduced via intravenous ways, such as in medication, in that case, the reaction is immediate. So what are the symptoms of AlphaGal syndrome? So the symptoms can range from mild to severe, and they can present as hives, rashes, itchiness without rash, actually, nausea, vomiting, diarrhea, constipation, abdominal pain, shortness of breath, difficulty breathing, swelling of tongue, lip, and the rest of the face, decrease in blood pressure, whole system shutdown with resulting anaphylaxis, and more. In fact, AlphaGal often is a diagnostic dilemma. And that brings us to the next point as to how do we diagnose this. Diagnosis of AlphaGal syndrome is typically made through a combination of patient history, IgE testing for AlphaGal, and sometimes food challenges. Because of the delayed reactions, skin prick testing and some other standard diagnostic methods for food allergies may not always be reliable. Blood tests measuring IgE antibodies specific to AlphaGal are more effective. How do we treat AGS? If you are found to have this condition, then your medical provider will recommend that you carry an EpiPen just in case. Also, steroids and antihistamines are periodically used as well, so please consult with your provider, of course. And it goes without saying that the main recommendation, is to avoid meat, specifically beef, pork, lamb, venison, goat, rabbit, and bison. A few words about dairy. 5 to 20% of people with AGS have allergic reactions to dairy products. Dairy products contain AlphaGal at lower levels than meat. If cutting down on meat doesn't take care of your symptoms, or rather eliminating meat doesn't take care of your symptoms, then you may need to eliminate dairy as well. So now let's move to medications and other products containing AlphaGal. So many medications are made from the materials derived from mammals and therefore contain AlphaGal. So the list includes some thyroid hormone medications that are derived from cows or pigs. Also, anti-snake venom therapy that is derived from horses or sheep. This list also includes a commonly used blood thinner such as heparin, pancreatic enzymes derived from pigs, gel capsules, vaccines that contain gelatin, such as measles, mumps, and rubella MMR and yellow fever vaccines. Also, as mentioned earlier, prosthetic heart valves from cows and pigs, also part of it. And as to the foods that contain gelatin, such as marshmallows, jelly beans, and jello, and other gelatin desserts. So what should people with AlphaGal do? So people with AGS need to avoid eating meat from mammals to protect themselves, to prevent these allergic reactions from occurring. They can, however, continue to eat chicken, turkey, fish, and other non-mammalian meats because those meats do not contain AlphaGal. Over time, the levels of IgE antibodies against AlphaGal decreases, and as the result, some people with AGS may again be able to eat beef, pork, and other mammalian meat and other products that contain AlphaGal without having the allergic reaction. However, if you have more Lone Star tick bite, then the levels of IgE antibodies will rise again, and you're back where you started with AGS. So in conclusion, for some reason, there are more cases of AGS, and it's important to be aware of it for both providers and patients to be able to diagnose this condition and subsequently design a new diet to avoid any foods or products containing AlphaGal molecules. Thank you so much for watching. Until next time. Bye-bye.